So to follow on the first video, how have we ended up in this situation that we're in now, this lockdown situation? Well, it all seems to have started with a prediction by Imperial College London. An epidemiologist, Professor Ferguson, made a statement saying that 500,000 people would die in the United Kingdom if we did nothing about the coronavirus. In other words, we just allowed it, as we have in the past, allowed it to pass through the population. Now, where he got this figure from, I have no idea, but it seems to have come from a mathematical model. Now, this was the same man, or this was the same team, who also used a mathematical model to devastating effect in the foot and mouth disease epidemic, which has been very, very controversial and highly criticised by other experts. Now, shortly after he made that statement, and it was all hell let loose, he lowered the estimation to 250,000 people would die from coronavirus flu. And then went on to say later that the numbers would be 20,000, providing we all stuck to the lockdown and non-contact situation. Well, just how true is that? I mean, how could we prove that that was the case if 20,000 people is the final figure? Because we have no country to compare it with. There isn't a control as such. There isn't a sort of an England somewhere where we didn't have a lockdown, which we can compare our England with its lockdown. The only similar country with a much smaller population which hasn't yet adopted lockdown is Sweden. And if they continue that policy, then I suppose a reasonable comparison could be made with them. But that remains to be seen. It might be that even without the lockdown, we end up with 20,000 cases. That doesn't mean to say that it was the lockdown which resulted in such small numbers, but I'm sure that that is what will be claimed. And what was the public's reaction to this catastrophic piece of news? Well, they all stampeded to the supermarket for toilet rolls. Zillions of toilet rolls. It's like something out of a Monty Python sketch. Like people were going into hotels and public toilets and pinching toilet rolls. Burglars, instead of going after jewellery or machinery or whatever, were breaking into building sites and pinching toilet rolls. It was unbelievable. I mean, why toilet rolls? Somebody must have started the stampede off. And everybody else followed. I mean, in years to come, when people are reiterating this tale about coronavirus and this news that 500,000 people were likely to die from it, and then somebody says, well, what did he do? And they say, we shut off the supermarket taking 100 toilet rolls. I mean, they won't believe you. The next series of videos just looks at various articles published around the world, which you can look at if you're desperate to fill up your time. This article from the Daily Wire from March the 26th looks at this downgrading of the numbers from 500,000 to 20,000. On the 25th of March, this article came out, written by Amanda Prestigiacomo from the dailywire.com. Government policy and guidance crafted in an effort to flatten the curve of coronavirus-related deaths has largely been based upon an Imperial College London model headed by Professor Neil Ferguson. The terrifying model shows that as many as 2.2 million Americans could perish from the virus if no action is taken, peaking in June. That model is highly flawed, Oxford epidemiologist Sunitra Gupta argues. Professor Gupta leads a team of researchers at Oxford University in a modelling study which suggests that the virus has been invisibly spreading for at least a month earlier than suspected, concluding that as many as half of the people in the United Kingdom have already been infected by COVID-19. If this is the case, fewer than 1 in 1,000 who've been infected with COVID-19 become sick enough to need hospitalisation, leaving the vast majority with mild cases or free from symptoms. With so many in the UK and potentially the United States presumably infected, so-called herd immunity could kick into effect, dramatically limiting the numbers of deaths modelled by Ferguson and company. The Oxford study is based on what is known as a susceptibility infected recovered model, I don't know what it means, of COVID-19, built up from case and death reports from the UK and Italy, the Financial Times explains. The researchers made what they regard as the most plausible assumptions about the virus. And the report continues, the modelling brings back into focus herd immunity, the idea that the virus will stop spreading when enough people have become resistant to it because they've already been infected. While the notion of herd immunity has been essentially dropped in the United Kingdom policy making, the Oxford results would mean the country has already acquired substantial herd immunity through the unrecognised spread of the COVID-19 over more than 2 months. The Financial Times emphasised, if the findings are confirmed by testing, then the current restrictions could be removed much sooner than ministers have indicated. Well, that's a major controversy at the moment. They don't have enough testing kits. They don't even have enough for people who are working in the health industry and on the front line. It's an absolute shambles. Anyway, to go on. I am surprised that there's been such unqualified acceptance of the imperial model, Gupta criticised. Of course, the epidemiologist encouraged caution and suggested changes to policy and guidance only be made after more evidence can be presented. The Oxford Group is working with researchers at the Universities of Cambridge and Kent to begin antibody testing on the general UK population later this week by using specialised neutralisation assays, which provide reliable readout of protective immunity, Gupta explained. We need immediately to begin large-scale serological surveys, antibody testing, to assess what stage of the epidemic we are in now, the professor said. Other respected medical professionals have offered a more optimistic look on the coming weeks and months with COVID-19 too. For example, Stanford biophysicist and Nobel laureate Michael Levitt said this week, "The real situation is not nearly as terrible as they make it out to be." And I'll look at that, I'll read that article out later on a different video. Last week, Levitt emphasised, "You need to think of corona like a severe flu. It is 4 to 8 times as strong as common flu, and yet most people will remain healthy and humanity will survive."